To another edition of Professor Speaks. Today's topic is we're going to talk about electronic medical records and how they do not contain accurate information. But before we get into that, I'd like to remind you to hit like and subscribe and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And today we're going to be talking about how electronic medical records do not contain accurate patient information. And let me explain first. Well, in the Journal of the American Medical Association. Thank you. Yeah, sometimes I need a little help. But it found that over half the patients, half of the patients were taking over-the-counter or prescription drugs that were not mentioned in the electronic medical records. And this is seen as a safety risk. Can you explain why that is?
It is. People tend to think that if you have a prescribed drug that your doctor prescribes, that's your medication. Mm-hmm. So they don't talk about over-the-counter, herbal drugs, etc., thinking that that is not a prescribed drug, therefore there's no influence of one versus the other. Right. But in fact, and it's terribly important, people take herbals and over-the-counter drugs, and they heavily impact what's going on with disease and what's going on with prescribed drugs. Just a couple of very simple examples, and not meant to be anything of the total volume, but cough and cold medicines frequently have decongestants. Those influence people that have high blood pressure because they can raise blood pressure. Mm-hmm. Issues with regard to sinus medications are frequently overused so that people tend to use it and then they get what's known as rebound sinusitis. Mm-hmm. And then they're going to the doctor in order to get medications to stop the rebound, the overflow that you get of nasal congestion, etc. But in fact, it was drug-induced because you used too much. Those are two examples. From an herbal standpoint, there's just an enormous number of issues that come on. People who take St. John's wort for depression interacts with a significant number of prescription medications, and so do many other medications you take for anxiety or herbals that you take for joint pain and things like that. These interfere with all of those. And so the idea that prescription medications, herbal and OTC, are different and you don't have to report that is total nonsense. You have to report all of it so that everybody knows everything about what you're taking.
Yeah, and the risk, I don't think we can stress it enough, is that these risks could be potentially fatal.
They could be. People, for example, who are on fish oil, where they're taking it because they want to cut down on their cardiovascular risk, their risk, for example, of a stroke or a heart attack.
Which is very easy to get over.
Very easy to get. You can get it just about anywhere in a market, a pharmacy, or otherwise. This can increase your bleeding time, so that if you're on a drug in order to help bleeding because you've had a stent, a cardiac stent, or you've had some other indication where you need it from DVT or deep vein thrombosis, some sort of a clot in your leg or something like that, this can make it worse. Right. So it's not a matter that it's irrelevant, it's that you have to know it so that you can manage it. It's yet another management thing that has to be done. This is terribly, terribly important.
And I have a couple of stats here, and Dr. Stern helped provide that for me. Thank you very much, Dr. Stern. Mm-hmm. Some of the researchers evaluated blood samples from over 1,300 patients and found that the electronic medical record drug lists and medications that were detected did not match over 63% of the patients. Yeah. And that's alarming because you're looking at the electronic medical record expecting to see a list of certain drugs, but based on the blood samples, they're getting a host of other drugs that weren't mentioned in the electronic medical record, which is alarming because of the interactions and all the things that Dr. Stern was stressing. And that including, you got residuals cohort, I believe you mentioned that, right? Mm-hmm. And 56% in the gastroenterology category. Who comes up with these categories? My goodness.
They started out as Latin.
And then you got 86% in the emergency department group. So you have several different departments of healthcare looking for drugs, trying to compare drug lists to what they see in the blood supply. So and then when you're trying to prescribe, you could see where some of the problems would arise for some of these doctors.
Well, absolutely.
Yeah.
And for example, in the emergency room, if the emergency room doesn't have a complete list of things,
Right.
the drug list is part of the what's known as differential. When you come in, they're trying to figure out what's the matter. And so they're looking for the most common things to the least common things, and they're going through it. Drugs are in the top 5 things that you ask about because they can cause disease. Drug-induced disease is very common. And for people that have 5 or more medications at any one time, drug-induced disease is one of the primary causes of a medical problem. So you have to have a complete list, or whatever is being evaluated, whatever is being addressed, you don't know whether a drug was the cause of it or not. The fact that they see blood and they look at it and they see there's different drugs than are on the drug list, that's very alarming, because then you really don't have any idea of what is causing the problem. It's not on the list, so you don't know whether they're taking it. They are getting it, but you're not sure how they're taking it, what the dose is, what the frequency is. You don't know.
It's like you're trying to imagine being the doctor, walking up to a patient and say, look, you have this, but on these 30 pages is what could have caused it.
Yeah.
And so you're trying to explain to a patient how to avoid going further into more of a medical problem, and you're already complex because you don't know what's causing any problem.
You know, this is a lot like veterinary medicine, in some cases like childhood medicine. People only know what you're taking because someone tells them.
Right.
Whether it's your animal or whether it's your child, you need to know what all the medicines are so that you can evaluate what's going on. Well, if you don't know, then you're walking in totally blind and you're trying to figure it out, and that takes time. It potentially could be something that would lead to further complications, or perhaps you don't know at all because you don't have a complete history of what happens.
Right. So what's a good way of attacking this sort of issue?
Yeah. 2 things happen. They're very simple, but they're absolutely crucial. They're necessary. One is make a list of all of the medicines, over-the-counter and herbal medicines that you take. Keep it with you. You can put it on a card. Many groups have cards that they get from the pharmacies, or it doesn't matter. Type it up on a piece of paper or put it in Excel and keep it, a copy of it. That you take with you all the time. So if you end up in an emergency room, people can see right away what medicines you're on, and by implication, what diseases are being treated.
And what about painkillers like Tylenol, ibuprofen,
Absolutely.
Advil?
Absolutely.
Right.
Because that's going to lead to many questions. One is, what are you using? How are you being treated? How much are you using? Because too much Tylenol can be severely toxic to the liver if you have it. Too much ibuprofen can be toxic to the kidneys if you do it. These are extreme situations, but people need to know when they evaluate.
And it's also good for the doctor to know when you're going into the hospital for pain. You tell the doctor, or the doctor asks you, have you done anything to try to curb the pain?
Absolutely.
So it's good information for the doctor.
Absolutely. And by implication, it tells them that maybe on your problem list, it doesn't identify that you have a particular pain, but now you're taking medicines for it. That leads to, well, what kind of pain is it?
Right.
Are we dealing with acute pain, chronic pain? Are we dealing with nerve pain? Are we dealing with cancer pain? What kind of pain are we dealing with? These questions are absolutely critical to the world to know. We tend to think of them as not being terribly important. I'm telling you as a professional, every person that is on medications must, whether you're on 1, whether you're on 5, whether you're on 10, it doesn't matter. You keep a list of your medicines, your prescribed medications, the medications that you're taking on an as-needed basis, the OTCs, the over-the-counter medications and herbals. Maybe it doesn't seem terribly important, but for someone who's looking at it, they see it and they know this could be a problem, or maybe it isn't. But either way, no knowledge is dead knowledge. You've got to have the knowledge.
And we can stress patient responsibility here.
Yes.
I mean, there are plenty of ways and avenues you can go about keeping a log of this, you can do it Dr. Stern's way and write it on the paper, like he had said, or you can do it the more younger and more hip way and use your phone. Your phone has apps available where you can log your prescription medication, or you can keep it on your calendar and make sure it's all in there when you take it and how much are you taking. There are several different avenues you can go about keeping this information on hand and ready to get to your doctor.
That's a great idea, Alex. Yeah. Having some of these apps on your phone. M will attach the JAMA article that we're talking about, but it's now showing up in multiple places, not just a JAMA study. And we can link some of the apps that you can put on your phones so that you can keep a list there, so you don't have to keep even in paper. It doesn't matter whether you want paper, you don't want paper, it doesn't matter. A list of all of your medications, including herbals and OTCs, is critical.
And I think it's also important to tell your doctor if you're using any recreational drugs as well.
Yes, recreational drugs do count. I think most doctors won't give you away to cops, I believe.
Well, actually, it's not that funny. M is right. Even if you're older and you don't use recreational drugs, that's important. If, on the other hand, you do have it, whether it's a one-time thing or a regular thing, you need it. Even if it's the new issues that are coming out with cannabis and other things, they do influence what's going on. And people need to know that. It has to deal with how drugs are absorbed, metabolized, excreted. You have to have this information because frequently one drug is metabolized on a regular basis than another. Alcohol, for example, is a very slow thing, but it takes precedence before other things can be metabolized. So you have to know what kind of information that you have so that they can make decisions. That's critical.
Right.
Okay.
And that's all I have for today. And if you have any questions or comments, you can leave them below, or you can send them through private message. We do read them, and we'll go through them and read them, and I'm sure she'll get back to us as soon as she gets them. And Dr. Stern, was there anything else you want to add?
No. Keep your list.
Yes. Keep a list. Communicate with your doctor. We stress that a lot. Communication is key. There is a circle of trust, and within that circle of trust is a doctor.
And a pharmacist.
And a pharmacist,
Either one
of course,
can help you as professionals in order to make sure you've got a complete list. It's absolutely critical to your care.
Yes. And we'd like to also remind you to go to propharmaconsultants.com. We do have free information and articles written by Dr. Stern himself and others. And we will be back next week. I'd like to remind you to hit like and hit subscribe and hit the little bell for notifications.